Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the Family Wellness Chiropractor and Wellness Care Coordinator at the CAP Wellness Center. And today we have our very own Maring Higa to talk to you about fertility and acupuncture. But before I introduce Maring to you, I want to take a moment to thank our sponsor, the CAP Wellness Center in Encinitas, California, who makes this podcast possible. Here at CAP Wellness, we have assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal and postpartum wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And now I'd like to introduce to you Maring Higa, our acupuncturist here at CAP Wellness. Natural medicine has always been an integral part of Maring's personal journey. She has studied extensively in the area of infertility, pregnancy, and postpartum recovery. In 2005, Maring traveled to Chengdu, China to intern with some of the best gynecological doctors in the world. Maring has specialized in treating male infertility, female infertility, and pregnancy support for the past 6 years, and continues to study the most up-to-date information in this field. Maring's personal experience of having a difficult pregnancy and then suffering with postpartum depression herself has made it natural for her to empathize with women going through these very difficult times. Combined with a Master of Science from Pacific College of Oriental Medicine and a psychology degree from Naropa University, Maring has created a truly integrative, compassionate, and heart-centered approach. When Maring is not in the clinic, she spends her time playing with their son, being with family, teaching and performing aerial skills, playing music, enjoying the outdoors, and writing. And with that, I'm so excited to bring to you today Maring Higa. Maring, welcome.
Hi.
Hi, how are you doing today?
I'm doing great.
Good. Well, thank you for being here, and I know we're going to have a great conversation about acupuncture and fertility. But before we jump into all that material, I just wanted to ask you to elaborate a little bit more on the bio that we just heard. Tell us about yourself and how maybe you became interested in acupuncture and then specifically into working with fertility issues.
Sure, yeah. So my journey has been, I feel like I've really been interested in holistic health since I was a kid, actually, and was that kid reading like vitamin books and interested in Ayurvedic medicine and Tibetan medicine. I'm not exactly sure what drew me to that per se, but it was always sort of in the background of my life. And when my dad was when I was about 15, my dad had been diagnosed with liver cancer. And at that point, he was going to the clinic, it's called the Bastyr Clinic, to receive acupuncture just to kind of help him palliatively through the chemotherapy. He was having a lot of nausea and vomiting and stuff. And that was my real first introduction into acupuncture and seeing that was really beneficial for him to just manage his symptoms, and kind of just witnessing that and seeing how that was helpful for him. And then, I continued my studies, didn't really know exactly where I was going to head next, but ended up going into psychology and then figured out quickly that wasn't for me. But again, had an incident where I'm an athlete as well, so I was playing soccer and had blown my knee out and wasn't able to play anymore, and it was pretty devastating to me. And someone had suggested, you should go see an acupuncturist, and so I did. And this acupuncturist was able to get me back on the playing field, where I really had no injury after that. I was totally fine, and that was pretty much the kind of changing point for me, that I really realized this was the medicine that I wanted to be doing, and decided to go to school from that point on. And it wasn't until later, sort of fell into getting into fertility. It was my first job out of school, was, a really high volume clinic, and was mentored by a man named Mark Sklar, and really just got my feet wet and loved it. I loved working with that population, that community. It was really challenging and also very rewarding. And that was great. And then I got pregnant pretty shortly after that. So
All right.
that definitely changed my viewpoint, and started working with moms during labor, helping them through labor, helping them through their pregnancies. And I really, really loved that, obviously, because I was a mom myself and could connect to these women, and could understand what they were going through, their nausea, their back pain, their postpartum depression. Like, all of that was very fresh and familiar to me. So
Yes.
kind of, yeah, I just have always, for whatever reason, if it was meant to be or not, it wasn't necessarily my chosen specialty, but over time being in it, it's really where I feel most at home.
That's beautiful. What an amazing story.
Thanks.
Sure. And now, so let's go right into it. So tell me more about acupuncture and Chinese medicine and how it really is helpful for fertility.
Yeah. So I get that question a lot. I get it a lot just to know how acupuncture works in general. And just to be really simple, the basic way that acupuncture works is by promoting blood flow in the body. So when we're talking about, back pain or knee pain or anything like that, you can kind of see how, lack of blood flow might create lack of function, might create pain. It's a little bit hard to imagine how that's going to help you achieve your goal of having a baby. And so what I like to do in our first visit is basically explain that to you, that what we're doing is whether it be your hormonal system that's not functioning correctly, or whether it's something physical, acupuncture can really help to restore balance by promoting more blood flow to those areas that are out of balance. So if it is a hormonal issue, for example, we will direct more blood flow using the acupuncture needles to those areas, so that those areas function better. Once those areas are functioning better, your chances of fertility go up, and then you have better chance of conceiving.
And then is it also in a physical sense, as far as the uterus itself, address issues there?
Meaning, does it change the
Say if there's like some sort of like physical blockage in the fallopian tubes, or there's cysts or something that a practitioner is telling a woman that's why they're not able to conceive.
Yeah, so there are certain things, like, you mentioned the fallopian tube. So that is one thing that is, I would say, is hard for us to work with, almost difficult. If someone's tubes are blocked, it's not something that I would say I have a very good success rate with. And the reason being is that, it's just usually takes something like surgery or something more invasive rather than what I'm doing. But
that makes sense.
But if it's a cyst or fibroid, something obstructing the uterus or creating difficulty for implantation, I have had a success with helping people. We call it in our medicine like stagnation. So if there's blood stagnation, it creates a cyst or a fibroid, something like that. And we can use acupuncture in conjunction with herbs and supplements to help move that out of the system.
Okay, great.
Yeah.
Now, and what does a typical treatment plan look like?
So that will also really depend on every individual. Our medicine is holistic in the sense that we look at everybody differently. So everyone, could come in with headache, for example, and I might treat them all differently, and they might all have a different treatment plan. And the same is true for fertility. So, with that being said, I would say that in general, I create a treatment plan for you that usually is about 3 months, and can range from anywhere to be seeing like 1 time a week to 2 time a week, or less frequently depending on your situation. But that's really all determined in that first visit, when we meet and really talk thoroughly about your health history, what's been going on for you, how long have you been trying, that sort of thing.
Right, and what other things you've tried.
Mm-hmm.
Okay. Now, is it something you had mentioned a 3-month plan? After that 3 months, do you do some sort of like a reevaluation and kind of check bases again to see if further care would be warranted, or how does it proceed from there? I mean, do you have people working with you for longer than 3 months?
Yeah, that's a good question. So, maybe I should back up a little and explain why it's generally 3 months. The reason I like to work with people at a minimum of 3 months is because when we're talking about eggs and sperm, the process of maturation of an egg is approximately 90 days, which is approximately 3 months. So really, although women are born with the amount of eggs that we're going to have, and that's it, we still have the ability to influence the quality, which can influence fertility and conceiving. So we want to be able to do that for that, at least that minimum amount of time, to make sure we optimize your chance of having a really, good egg, healthy pregnancy, healthy labor, and so on. The same is true with sperm, although it's a shorter process. It's 72 days. So it's like a conveyor belt. Even though you have a sperm and it's kind of going down the conveyor belt, and 72 days later, that sperm is then ejaculated. So it still has a maturation process, and we can affect and influence those things by one, diet, of course, exercise, herbs, supplements, and then of course your treatments like acupuncture, chiropractic, massage. Those are all really great things to do to help influence and improve the quality of sperm and egg. Having said that, afterwards, of course, yes, I've had people work with people longer than 3 months. I don't want to give the expectation that I can get everyone, help everyone after 3 months. But it's sort of the starting point is starting with 3 months.
And so is it common that you see both the dad-to-be and the mom-to-be, or is it usually more the female? Or is it, I guess that probably depends on testing that's done beforehand.
Yeah. So I like to have a sperm analysis done just to make, to know 50%, or maybe it's more now, of infertility cases are actually due to male infertility.
Is that right? Wow.
Yeah. So it's quite a higher number than we think. So if there is a sperm issue, whether that's morphology, motility, or their count, I like to see both of the couple. It's also really nice, even if they're, the sperm's fine and the cause is unknown, at least seeing them both in the first part of the treatment is nice, because this is something that they're doing together. This is something that they are creating together. It's a really great for both parents to be on the same page.
Yeah, and the healthier that dad is going into conception, the healthier the baby is going to be as well. And that makes sense for it to be a partnership.
Absolutely.
Now, for people that haven't done acupuncture at all before, there's a lot of reservations that sometimes people have around needling and the like. Could you walk a person through what a typical first visit's like, and what the experience is like? I mean, I know as an acupuncturist or acupuncture patient myself, needling does not hurt at all, but it might be best hearing it from you as well, like how that process works, so there we remove that barrier.
Sure. Yeah, I get this question a lot, and I fully understand it. I think when we think of needles, we think of hypodermic needles, which are hollow and big and are, going to take blood from us and all that. And I myself have fear of that. Acupuncture needles, on the other hand, so on your first visit, you'll come in, we'll do a nice long intake. get to know each other, answer any questions you might have. I will give you, as much information as I can about whatever's going on with your situation and also about acupuncture. And then before we even start, I will explain everything that's going to happen. So typically I'll show you what the needles look like and explain to you that they're stainless steel. They're one-time use. We throw them away once we're done. And they're about the size of a human hair. So if you can just imagine how thin that is, most of the time you barely even feel the needle go in. And I would say the other part of the time, what you feel is maybe something that resembles a prick but then goes away. You might feel a warmth sensation. You might feel a heavy sensation, but all very comfortable sensations. Most people actually fall asleep on the table. They are that comfortable after the needles are put in. So, it's a very relaxing, believe it or not, experience.
Yeah, I know my experience receiving acupuncture. I'm always really kind of zen, mellow afterwards, and really hungry.
Mm-hmm.
I get really hungry after my acupuncture sessions.
Yeah, that's not uncommon. We're moving blood, like I said before, so we're moving things in the body. That's not, the digestive system is definitely connected to that as well. So it makes sense to be hungry and thirsty.
Yeah. Well, all of this information has been fantastic, and I know our listeners may want to be getting in touch with you. How do you recommend them doing that, learning more about your work or getting in touch with you if they want to take some next steps?
Sure. So my personal website has a little bit more information about me and what I'm doing. I have a blog on there as well, is at my first and last name, .com. So it's MARING, the last name HIGA.com. And then, of course, we're going to be posting a lot of things on the CAP Wellness Center. We'll have videos to education and lots of good stuff there. And that's also a great way to kind of keep in contact with us as well.
Okay, great. And for those of you listening, I'll include those links in the show notes, so it'll be attached to how you're listening right now, so you can link right over to that. So thank you for that. And the last question I wanted to ask, just to kind of wrap things up, is if there was one thing that you could just summarize things for the moms or the moms-to-be that are listening right now and take to heart, what would that be right now?
I would say that, belief and the power of your visualization and already believing these things to be true for yourself, like that already holding that baby in your arms, already enjoying their first birthday and all that, that is so powerful. And I've seen it over and over again. So I just wish for everyone that, you already are moms, you already are dads, you already are parents to be, and just holding that lightly in your heart. It would be my words of advice to you.
Oh, that's beautiful. Thank you for sharing that. And thank you for sharing everything here today. Like I said, a lot of the information that Maureen talked about will be in the show notes, and you'll be able to find it on our capwellnesscenter.com blog as well. Well, Maureen, thank you so much for sharing your time with us today, and it's been a pleasure talking with you.
You too. Thanks for having me.
My pleasure. Wish you all the best.
All right.
Take good care. Be well.
Bye.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the CAP Wellness Center look forward to helping you and your family be as happy and healthy as you can be.